Hi, this is Dr. Doug Willen, and welcome back to the mini course. This video is on how thyroid and stress are related and why it's important to get a handle on your stress, because one of the things that it will be harmful to is the thyroid. And so let's hop into this section. I like to go back to our favorite camel, which we've been looking at through the course. And I don't know if you can see his little face towards the middle bottom, and the man is sitting on top of not only all the straws that break the camel's back, not only is that not enough, but then the man has to jump on top. So in this case, the straw that breaks the camel's back might be the addition of a human on top of his back. Remember, in case you haven't watched the previous videos recently, I was just making the comparison that a straw a day of stress can break the back of your immune system, break the back of your overall health and well-being. And it doesn't happen in one moment, 1 week, 1 month, but over a period of time, over a lifetime, stress can have a harmful effect on the way we perform in our health, the way our immune system works, and just our overall quality and well-being in life. So let's hop into this topic, which is the thyroid. Now, the thyroid is a gland that makes and stores hormones that help regulate the heart rate, blood pressure, body temperature, and the rate of which food is converted into energy. So when we eat food, it needs to power our body. It's our energy source. And if the thyroid is off, that doesn't happen. Thyroid hormones are essential for the function of every cell in the body. Every cell. That's amazing. So this little gland that's in your neck, which I'll show you a picture of in a second, works with every cell of the body. The thyroid gland is a ductless alveolar gland, means there's no tubes, found in the anterior part of the neck, just below the famous Adam's apple, and it is roughly a butterfly shaped with 2 lobes, wrapping around the trachea, which is the windpipe, and connected in the middle by an isthmus. And the isthmus is this little land island between the 2 lobes. I have a picture of that too, so I can show you that. The thyroid gland is not usually palpable, so when I reach in and touch it, I shouldn't necessarily feel it in most cases, except if it's inflamed, and then your doctor might be able to either palpate half of it, or the full thing will feel boggy and spongy, or sometimes you might even be able to perceive a little hardness or a node, and those are not good things. So we want it to, for the most part, to not be discerning through palpation or touch. So here it is. Like if I tilted my head up, you see where that would be, and you can reach in and touch your own. If you're a man, you might be able to feel your that cartilage, which is your Adam's apple, and just below it is your thyroid. If you're a female, just palpate the base of the bottom of your neck. Here's the 2 bones of your collarbones. Come above it, there's a little soft space, and just right in there is where your thyroid would be. Here's another picture just to give you another look. And you could see in the middle, there's an island here between the 2 lobes. So there's a right lobe, a left lobe, and a little center connecting piece called the isthmus. And, you know, I always thought it was fun because in geography is the first time I heard that word. And the isthmus of Panama, for example, connects Central America to South America. So you can see these 2 big bodies of land, and in the middle is a connecting little piece of bridge, a bridge piece, and that is your isthmus. Let me go back 1 slide, and there you could see the isthmus of thyroid. So just thought that's interesting. I like how very often we borrow medical words from real things, sometimes from humans, from animals, from geography, and I enjoy sometimes the etymology of a word is fascinating to me. The thyroid gland is a vital hormone gland, so this is vital to the body. It's not secondary It's not a vestigial gland that we don't need. It's something that we really need. It plays a major role in your metabolism, growth, development of the human body. So let's say your thyroid was impaired as a growing toddler, as an infant, you would have failure to thrive. So this is a vital gland. It helps regulate many body functions by constantly releasing a steady amount of thyroid hormone into the bloodstream. Some of the things that it affects, so like if you are not getting the adequate amount of thyroid released into your bloodstream, here's a list of some of the most common symptoms associated with that. Fatigue, weakness, weight gain, or difficulty losing weight, even if you reduce your food intake. So let's say you go on a caloric reduction, you're heartily attack, I can't even say the word, into a vigorous diet, and you are not the one that's getting any results. It may be because your thyroid is exhausted, or maybe the levels are off. Coarse, dry hair and dry skin. So your skin and hair and nails might be drier and more brittle than you're used to seeing. Some people lose hair. Happens to women a lot. They will lose hair when their thyroid is not functioning properly. You're the type of person that's sensitive to the cold all the time. Your muscle cramps, you can develop muscle cramps and aches, constipation, your bowels not moving on a regular basis. It could be a cause of depression, irritability, memory loss, abnormal menstrual cycles, a decrease in sexual libido where you feel you're not in the mood sexually and you wonder why. It could be your thyroid. Slow speech, but that would be in more severe cases. Jaundice in severe cases, that's kind of the yellowing of the skin, palms, and the whites of the eyes due to liver dysfunction. Increase in tongue size, that's just an extreme one. I've never seen that in clinical practice, but that's possible. And again, though, I don't work with people in that level of medical crisis because I'm not that type of doctor. But that is in the literature, and it just shows you how far-reaching the thyroid is and how it can affect severely, have an impact on so many different areas of the body. One of the most common symptoms of low thyroid is feeling worn out. And that ties right into what we're talking about in this mini course, which is stress. So if you're, and it's a two-way street. So if you're stressed, it can wear out your thyroid. And if your thyroid is worn out, it could overwhelm you where you're exhausted all the time. And functioning and doing your life on an exhausted mind and body is stressful. And so it's kind of a vicious cycle. So it's very important that we support the thyroid, hopefully naturally, if you are able to manage it naturally without going up the medical ladder into more intervention. The thyroid hormone controls energy balance, and it can influence whether you feel ready to go and start your day or whether you feel like you need a nap 1 hour after waking. When thyroid levels are low, your metabolism switches modes. Instead of burning calories for growth and activity, the amount of energy you use at rest or your basal metabolic rate decreases. As a result, your body tends to store more calories from the diet as fat. What I'm saying there is it's very hard to lose weight and very easy to gain weight when your thyroid is off. That's stressful. Think about it. Even when you're sitting, you're burning a small amount of calories. So like just for this video, I've probably burnt a little bit of calories just sitting here yapping away talking. I don't have to necessarily be on a treadmill or walking or doing active exercise to burn calories. You're still burning calories while you're sedentary, just not as much. However, in cases where your thyroid is low or under functioning, your basal metabolic rate decreases, reducing the amount of heat you generate. So therefore, even in your resting state, you're not getting really any calorie burn like you would if your thyroid is acting and functioning in an efficient manner. About 40% of low thyroid individuals feel more sensitive to cold than usual. And we see that a lot. That's very common. That's that person that's always cold, that always needs a sweater, that you're in a restaurant and they're the ones at the table wondering if the restaurant should turn the air conditioner down. And you feel just fine, but that other person at the table is saying, do you think we should ask the manager to lower the temperature in this place? So they're the ones that really perceive cold much more than others. Additionally, 34% of low thyroid individuals get muscle cramps in the absence of recent activity. So imagine this, you get a muscle cramp or a Charlie horse and you didn't even work out. That could be from low thyroid. Low thyroid hormones cause hair follicles to stop regenerating, resulting in hair loss. This will typically improve when the thyroid issue is treated. So this does not have to do with my hair loss. Mine is hereditary or genetic or male pattern baldness. And what we're talking about is more when women are getting hair loss due to stress, adrenals, thyroid, and often they can start to reclaim that when they take some type of adrenal or thyroid support that balances their endocrine system. If I take my own thyroid product, it doesn't grow my hair back because mine is coming from male pattern baldness. So don't feel bad for me. I like the way my hair looks. I feel okay with it. But my clients we're talking about in this case are the women that are in their late 30s, 40s, 50s, 60s, and they feel like more than their fair share of hair is coming out. And it doesn't make sense for them why this would happen. They might want to try my thyroid or adrenal product or both, but also start to check their levels, maybe meet with their doctor, see if there's an underlying, measurable empirical data that supports that. What's interesting to me is I read a book by Mary Solomon, on low thyroid, and she quotes a statistic that 13 million Americans have undiagnosable low thyroid. So what that means is their thyroid on blood work, 13 million people, it comes back and it's still in a normal range, but they're having all these thyroid symptoms. So sometimes with the thyroid, you have to wait till it's really messed up, till it's really a problem, till it finally shows up in your blood work where you'll get the proper diagnosis. That's a good patient for me because I like working with someone that might not have a full-blown disease yet. They're further upstream. They haven't floated downstream where they're diagnosable, but they know something's not right. And that's the type of person that does respond to diet, to nutritional supplement therapy, and we can see great turnarounds and changes with them because they don't have a full-blown diagnosable disease yet. So that is pretty cool. Hair follicles, I mentioned this, but hair follicles, skin cells are categorized by rapid turnover. Therefore, they are also sensitive to losing growth signals from the thyroid hormone. So we want the hair to turn over. We want the skin to slough off and regenerate. We lose skin cells, we gain skin cells. Hair follicles come out, hair follicles grow back. It's a constant cycle in the body. And one of these triggers for that cycle to maintain its normal pattern is the release of thyroid hormone. So when the thyroid hormone is under functioning, you don't get great skin turnover and hair turnover, and your skin, hair, nails are not at optimal level. So you could see, now look at that. That is not the back of my hair. I know you're thinking, wow, that looks like Dr. Doug's hair. But no, that's someone who has very brittle and dry hair. Maybe can I go over here and then you think it's me? Maybe not. Little humor for you. But what happens when your thyroid is under functioning is your hair is brittle, dry, it feels like it breaks, it's too coarse. And if that's how your hair has always been, well then that's just the way your hair has always been. But I'm talking about changes. So people go through life, they have this luxurious, rich hair, they're proud of their hair, and all of a sudden they're 50 years old or 40 years old or 60 years old, and their hair starts to have this type of quality and texture, and they know that that's not how it should be. They might be a good candidate to get their thyroid balanced. And what's really nice is you can stair step. You can start with something natural. The formulas I make work with this, work very well. But if you have an extreme case, you might be a medical case by then. But there's a huge continuum on a scale of 0 to 10. So let's say 8.5, 9, and 10, you are a medical case. You're so severe you need to be under medical care. Understand. But what if you're a 1, a 2, up to a 5, a 6, a 7, where you do respond to natural supplementation, therapy, diet, sleep, working on your stress levels, and you see a change in your skin, hair, nails, energy level, your digestion, your sleep? That's exciting. And it's exciting to fix things while you still can. So that's what these videos are about. That's what this mini course is about, is working on as much as we can naturally so we don't have to escalate up the ladder of invasiveness to where we're in crisis and we have to be under strict medical care. So I find this interesting. I mean, who doesn't have someone that battles depression in their life? Maybe themselves, maybe a loved one. This is something pervasive. We all know people that are battling depression. And hypothyroidism or low thyroid is linked to depression. I'm not saying it causes it every case, but you give me somebody with a thyroid that's off, that's not functioning at its best level. And remember what I said just a minute or two ago, that 13 million Americans can't find a diagnosis in their blood work for sometimes 10 or 20 years before it finally shows up. So they know their thyroid's off a little bit, and they might be suffering from depression, from melancholy, feeling blue all the time, mood disorders. And the proof of the pudding is when they start to balance out their body, when they start to re-nourish and get their thyroid and adrenal and getting good night's sleep, they start to feel the dark cloud of depression lift. Maybe it doesn't fix everything, but they see a difference, and I love that. 64% of women and 57% of men with low thyroid will report a feeling of depression. So that's a high number of people that when their thyroid is off, they'll feel a connection to their mood. Big stuff. Many patients with low thyroid complain of feeling mental fogginess, that mental acuity, that brain fog that you feel when you just can't come up with the word, come up with the number. You just feel mentally and brain tired. And if you don't know what that is, you're probably under 20 years old. But if you're over 20, over 30, you might have already experienced it. I mean, I first felt a little brain fog or mental acuity depletion when I was in college. And I remember studying for finals and cramming and pulling all-nighters, and you'd feel that brain tiredness. Now you feel it more often as you age. You don't need to pull an all-nighter to feel that. It becomes more of a regular pattern in your life. And thyroid makes a change with that. It's really fun to see someone start to balance their thyroid and their mental acuity get sharp again. Bowel, constipation. When the thyroid is sluggish, everything is sluggish. Your metabolism is sluggish. Your elimination or your bowel movement becomes sluggish. Not for everyone. I've even seen people with a more looser bowel, with diarrhea, that have low thyroid. But for the most part, constipation affects 17% of the people with low thyroid. Thyroid hormone interacts with other hormones that control the menstrual cycle, and abnormal levels of it can disrupt their signals. So thyroid works with estrogen, it works with progesterone, it works with all your different reproductive hormones. It has a direct or indirect effect on. It affects your ovaries, it affects your uterus. So if your thyroid is off, you might see a higher degree of infertility. And, it's funny because a lot of the fertility centers where they do artificial, I think all of them, that do artificial insemination and help people with getting pregnant with fertility drugs, one of the first things they do is check your thyroid. Why? Because they know that when the thyroid is off, it's almost impossible to get you pregnant. And when your thyroid is on, we're at least in the ballpark. So it just shows you how pervasive the thyroid is. Every cell of the body, as I mentioned. Both irregular and heavy menstrual bleeding are linked to low thyroid. So if you're the type of person that literally has the hemorrhaging type of menstrual cycle each month, you're passing clots, you are bleeding much more than you ever have. Some women that come into my office are bleeding 2 weeks of every month and heavy. Going through, one sanitary napkin every hour. Got to look at the thyroid for that. So this next slide is a little video like I did in the former, like I've been doing. I'm showing you a little bit of the product that I made that's specific for this, that's natural. It's only about 40 seconds long, and so let's take a look. This is my thyroid formula. A thyroid is a little gland shaped like a butterfly at the base of your neck, and it acts almost as like the little Duracell battery of your body and metabolism. When that thyroid is not producing at the levels you need, you're going to feel fatigued, you're going to feel like you lack mental acuity, you're going to have hair loss, you're going to feel cold all the time, you might be constipated. So many symptoms are directly related to the thyroid being sluggish. This is a product, since it's all natural, there's no hormone in it, and it's vegan, that you can take as a daily supplement to get your thyroid, to get your energy level, to help with weight loss, get you back on track. Give it a try. So, wrapping it up, we have one video left, and that's putting it all together. So I hope you can hang in for that video. In that video, I'm gonna kind of talk about what we can do about it now. Like, what would be a game plan that you could tackle? Of course, if you have severe symptoms or your blood work's coming back with abnormal findings on your lab work, please get in with your medical doctor or your endocrinologist. I'm not your endocrinologist. I am not your medical doctor. I'm here to give you healthy tips, advice, stuff that you can learn on your own that you could approach while you're, like I said, upstream on the health continuum. You haven't floated all the way down into a level of crisis. You don't need the safety net of medicine at this point, and you're looking for natural ways to feel better and do the best you can. So we'll see you in the next video, which is the last one, which is wrapping it all up and putting a plan together. See you there.